Welcome back. You've probably seen billboards or heard stories about Narcan and how it saves lives, but there's also myths surrounding it that are preventing people from learning how to use it. Here to discuss more about the facts and benefits of Narcan is Christopher Weber from our sponsors at Spectrum Health and Human Services. Welcome, Chris. Thanks for joining me.
Thank you so much for having me.
Of course. Now, for those who have missed our Spectrum Health's previous segments, can you give us some background about the organization and some of the services that you're able to provide?
Absolutely. Spectrum's been in Western New York for over 50 years now, offering behavioral and substance abuse counseling to adolescents, children, and adults.
Okay, nice. Now, the big topic that we're discussing right now is Narcan. So for our viewers that don't know, what is Narcan?
Narcan is the opioid overdose reversal medication. So when someone's overdosing, they're not breathing, this enables them to be able to breathe again.
Does having Narcan available actually encourage drug use? That's kind of the big thing that people are having discrepancies over.
Yeah, we have a lot of conversations about it, right? Somebody can't Narcan themselves when they're overdosing. So, that person using isn't hoping to Narcan themselves after they're using. So, no, it just enables a person to be able to breathe again.
Right. Here's the thing about drug use and people that are struggling with addiction. People are going to use, but we don't want to continue to see people dying. We want to be able to have things that are going to save lives. So having Narcan in bars and clubs just means that if something does happen, if the worst does happen, it doesn't have to be the end, right?
Correct. We just have the tool to give them the ability to continue breathing.
Well, let's talk about harm reduction. That's something else that we talked about with Spectrum Health last year, or last time you were on. Tell us what that means.
Harm reduction is enabling people to use safely. People are going to use substances. There's plenty of tools out there, whether it's not using alone, testing your substances before they use them. It gives them the ability to use in a safe manner.
And that is kind of a stigma. You use the word enable, which is people's argument. Oh, well, you're enabling drug use. Well, again, people that are struggling are going to be using regardless, right?
Absolutely.
We want to make sure it doesn't mean that if you're using and if you're having trouble fighting addiction, that means it's going to be the end. We want to make sure that you're being safe until eventually you're able to get over that addiction, correct?
Absolutely. The other thing too is majority of overdoses aren't people just using opiates. It's polysubstance where somebody might be using cocaine and fentanyl is laced with them. They're not necessarily the typical drug addict you think of.
Right.
So this is enabling people to use safely.
Is harm reduction effective? Have you been able to see a reduction of death rates?
Yeah, the death rates we're starting to see a decrease in number of people with overdose deaths.
Why is Narcan and harm reduction measures so widely misunderstood, do you think?
I think it has to go back, culturally. The war on drugs didn't necessarily work, but it's been so ingrained. And I think now we're having conversations with younger people. We're tabling at schools, and the students are really engaged, and they want to be safe, whether it's for them, their families, friends, whoever they know is using.
I think from when I've been talking to Spectrum Health with these segments, the biggest thing is you want people to understand you are not, as an organization, encouraging drug use.
Correct.
You're just trying to make sure that people are safe.
Our big thing is meeting people with where they are. So it's, if people want to still use how they use safely, or if they want complete sobriety, what can we do to help them?
That's right. We talk about this often and how addiction hits all different people. It doesn't matter who you are, where you are, your background, what race you are. It can affect anybody, and in different ways, right? We're not always talking about hard drugs. We're talking about different things. But we want to make sure that along the journey, people are still able to have a chance to fight it, right?
Yep, absolutely.
Well, if our viewers are interested in learning more about Narcan, harm reduction, or more about Spectrum Health and the services that you have to offer, can you share where they should go?
Yeah, so you can either go to the Oasis or Erie County website, or you can check out the MAT team at Spectrum Health. Does a lot of tabling events in the community where we offer free Narcan training. We'll give you a kit. You can come check out our website at shswny.org.
Well, thank you so much for coming in, Chris, and sharing more. This is kind of a taboo topic, but we need to start discussing it more.
Agreed. Thank you so much for having me.
Of course. Viewers, if you'd like more information on the harm reduction resources provided by our sponsors at Spectrum Health, you can visit shswny.org or call the number right there on your screen.